what are the problems that have been faced with marketers? And the reason we ask this is because for owners and administrators, I want to share with you the problems that I've had and the problems that's currently being experienced by other home health agencies or other agencies have experienced as well. So when we've asked these questions, they literally say this: they don't have one. And that's a big problem. You need to have one. You need to have more than two. But at the same time as they need to be trained, they need to be rehearsed, they need to be drilled on a daily basis to know what to do, when to do, and to have somebody to talk to, like myself, if they come up with some problems, and to give them directions. Or I've even had agencies say this: they don't have a full-time one. The fact that they don't have one, or they don't have a full-time one. Part-time marketers will get you part-time referrals. And sometimes part-time marketers are not going to get you any referrals, more likely. Or they'll say, I'm the jack of all trades, like I talked to you guys about earlier on, where the administrator and owner, the owner is the administrator, they do payroll, they also do scheduling and so much more, that they really don't have any time for marketing their company. Or the fun part, my marketer left for another agency. You know, we have these marketers that jump ship all the time, go from agency to agency. You know, they go to the next best thing to be able to get, you know, a higher salary until they've proven themselves that they're not good at what they do. Then they move on to the next one. And most of the time, I've seen agencies will hire a new marketer. This actually just happened about three months ago, where this agency hired a marketer, and I asked them, well, did you check for references? And they said, no, I don't want to check for references because they asked me not to tell their old boss about that he's transferring to them. So I told them, still call them, because I guarantee you're going to get some insight. And sure enough, they told the owner that this particular marketer did not bring any patients for 6 months. And, you know, imagine that if you have this marketer working for you, and for 6 months you're paying them, and they don't bring in what they were told to bring in. It's very important that you guys are monitoring your marketers out there, okay? Other problems is, I don't know what they do. Like, they have a marketer, but they don't know what they do. It's very important to be able to keep in track. Just like how nurses, we keep in track of our nurses. We look at their nurses' notes. We look at, you know, their visits. Some nurses nowadays are being tracked by a GPS. And it's important because we need to know where they are, what they're doing. It's very important. And because it's very important, by being able to know what they're doing, if they're making a mistake, they can go back to you and say, hey, Michael, you know, I've had this problem. Can you help me with this? I for some reason, I can't get a hold of this physician. Can you try to give him a call for me? You need to be able to have communication with your marketing team. Definitely a good one as well. The next one is, I've seen home health agencies will pay them and not get any patients. Typically, I will only give a new marketer 3 months. And if they can't prove themselves by then, they lose their job. And typically, I start looking at them 2 months into the program, because after 2 months that they've been working with me, they should have been producing or started showing a steady increase of that. And remember, for new marketers, for you to hire new marketers or, you know, have them in your business, you have 90 days or 3 months, and after that, they can claim unemployment. And you need to know how to get past that. You need to be smart about what you're doing. So if you're taking this class right now because you want to become a marketer, well, I'm teaching you what I teach agency owners, because you shouldn't do what other marketers are doing in regards to cheating other agencies. That's not nice. It's going to come back to bite you one of these days. You want to be able to work hard to keep your job, to prove yourself, to get paid good money, to get paid 6 figures if you can, because that is possible as long as you're bringing in a lot of clients. All right, you need to be able to make sure that you do what you do to keep your job. And agency owners and administrators, you need to do what you need to do to market your company and also to monitor your marketing team as well. But the best piece of advice that I can actually give you is this. You need a full-time marketer to get full-time results. But other than getting a full-time marketer, you need to get a marketer that is trained, drilled, and rehearsed and knows how to market great with a great supporting team within the business. The next quote I want to be able to share with you guys is this. It's a J.C. Penney quote, actually. So, give me a stock clerk with a goal, and I will give you a man who will make history. Give me a man without a goal, and I will give you a stock clerk. J.C. Penney said that. So, do you have a policy of managing your marketers? Or if you're a marketer, does your owners and administrators manage you? Where they actually literally expect you to give a report to them on a weekly basis, on a daily basis? Now, if you're a current agency right now and you need help with this, let us know. I'll be glad to be able to guide you on how to create that policy of managing your marketers, of expectations and taking in referrals. Look, here's the honest truth. If you're an owner, if you're an administrator, if you're a director of nursing, if you are the marketer, and you are responsible to get clients, right? Then it's our fault why you did not get the referrals. You have to know that it's your fault. You have to understand that if you're marketing your company, it's your fault. It's our fault as marketers if we can't bring in patients, not the referral source, right? It's our job. And so my goal is to show you that this is true, and at the same time is how to get over the problems. So let's get started with objections. All right.